What's up, guys? I know this isn't the best lighting. I'm inside, obviously. Yesterday or this morning, I posted a video on YouTube of me like walking around, trying to, like move gas around after ostomy reversal. And I cannot stress enough how bad the ostomy reversal gas pain really is. I had my ostomy for eight years, and so now that everything is reconnected for the first time in 8 years, as I'm now relearning, like I'm eating and my bowels are relearning how to digest everything completely a different way. And, I'm also relearning how to use the bathroom again from my bottom as if I'm a toddler. I can say the gas pain is really bad. Like there's moments where I'm sitting on the toilet and I am almost in tears because it hurts so bad and feels like I'm literally gonna die. It's like, you know, my insides are moving around so much compared to what they ever were, and it's just so much movement. And, on top of that, you have the inflammation from the surgeries, and like everything's trying to heal, and it's just a very uncomfortable time. I'm still on some of the pain meds, but I'm trying to wean myself off and only use them for when Shelby's packing my wound and it's being unpacked, and then if I'm having a really hard time sleeping. Because I get a lot extra gas pain at night and more stiff, so I tend to get more pain in my stomach at night. So right now she's currently gone off to get my medicine because it's really hard for me to do car rides right now because it is just so sore. Um, so it's easier for me to stay home and just rest while she goes quickly and gets what we need. But I cannot stress enough, the gas pains are just, they're killer. I mean, like on a scale of 1 to 10, they're 10. And then, like, like I'm taking like gas X and stuff, and it kind of brings it down to like a 6 at times. But then as soon as I eat again, it's like right back up there, and it really sucks. And they said it could be like a couple of months, maybe even longer than that, for my body to adjust to the fact that I'm using the bathroom like like I'm going out of my bottom, and I'm not going through my bag anymore. So it could take months to like a year for everything to really align itself with like relearning how my body's going to react to certain things. So right now I'm eating like a low fiber diet. So like I'm making sure like I eat less meals throughout the day, and try to do it as frequently as I can. I'm really honestly not that hungry. That's also a problem. Like I'm not really hungry, and then I'll get hungry and I'll try to eat, but then I feel so full that like my stomach just really hurts. Um, but they want you to try to eat less meals throughout the day, but more frequently, so your stomach can get used to it. But it's hard when you're really not hungry. And then also I'm drinking a lot of water, obviously, making sure I stay hydrated. I've got different juices. I've got some electrolyte stuff. Anything really to keep me hydrated is the most important thing right now because I'm going to the bathroom probably between 8 and 13 times a day. Um, and a lot comes out at a time, and it will never fully be solid, but it will, because of the food, it will get like pasty and be a little more thick, but it will never be like fully solid because it's just not a possible thing, I guess, is what I was basically told. Which is whatever, but unfortunately that means a lot of butt cream's being used because my butt literally burns. Like, it's not used to being used that way, so it burns a lot and it, hurts. But I can say that as I eat food, like I sit on a couch and I'm healing, and I don't have to worry about jumping right up and running to the bathroom to empty my bag anymore, which is a really odd feeling because like before I was so used to constantly, I would eat food and then within like a few minutes I would have to get up and go empty. Like I would always have to make sure that I had a restroom right by. Obviously with recovery right now, because I'm still learning like when I gotta go to the bathroom and how I can hold it and stuff, I still want a bathroom nearby, but I'm not thinking about the bathroom like 24/7 like I was before. Like I was constantly thinking about a restroom. I feel like a lot of the time, especially before bed. Like if I had like a snack or I wanted to have a quick little like piece of candy or something before bed, I'd be like, oh, I can't have that because I'm gonna have to get back up in like 5 minutes and I don't want to. Whereas now I won't have to worry about it because I can have a snack And literally, as long as I don't lay right down, I won't get indigestion, but at least I don't have to get right up and use the restroom, because it's not like I'm eating and then going right to the bathroom. And that's probably the best thing about getting the reversal, is not constantly having to worry about the bathroom anymore. But I just wanted to give you guys an update on the abdominal cramps and how they feel, because I didn't really touch a lot of base on that in my video. I just kind of said I was trying to move things around, which moving around helps, a lot, but it's still, there's a lot going on in there right now. It's very tight, very inflamed, and very, very much filled with extra air. So, it's just one of those things. And I think in my next video, I want to talk to you guys more about like what happened while I was in the hospital, and things that weren't necessarily supposed to happen that happened. That was really scary, but I'm glad that it's over with now. But for now, I really can't thank you guys enough for coming along in this journey and being part of the journey. It's been a long time coming, like I said, and I cannot wait. Like, this is the perfect time. It's like about to be spring, or it is spring, and summer's coming, fishing is coming, swimming is coming, and I'll be able to do all of those things for the first time again without an ostomy bag being like a challenge for me. And I can't remember the last time that it wasn't a challenge for me, so I really can't wait. And I can't wait to bring you guys along for those like really exciting adventures, and me being more active and wanting to do stuff again once I am healed. So thanks for watching.